Welcome to the Broken Graciously podcast, where we challenge the culture of brokenness by exchanging beauty for ashes holistically, with candid conversations, transparency, and practical tips. I'm your host, Tanisha B. Lester, lovingly known as Coach T. I'm a Master Certified Life and Business Coach, Certified Christian Coach, Certified Pastoral Counselor, and published author. I look forward to engaging with you in the comments as well as on IG. Follow me on IG at Tanisha B. Lester with the number 1. Please like and subscribe to this podcast. Welcome to another episode. This is episode 3 of Broken Graciously, where we challenge the culture of brokenness by exchanging beauty for ashes holistically with candid conversations, transparency, and practical tips. So today we are back again with Dr. Ashley. If you tuned into the last episode 2 of season 2, we talked about depression with Dr. Ashley and how that affects women more disproportionately than there's only one other gender than men. But those are the people that she deals with. But let me give you the stats on Dr. Ashley. So Dr. Ashley is a board certified nurse practitioner practicing in psychiatric and addiction. Her aim is to remind clients that self-love is best when it's contagious. Ashley began her career as a patient care technician, later advancing her education to become a nurse practitioner and adjunct professor. She has training and experience treating psychiatric disorders in teenage, adult, and geriatric patients. Ashley brings a humanistic philosophy of holistic care for mind and body and an abiding commitment to individualized, personalized, and comprehensive care for patients. Ashley served our country in the U.S. Army. She is an active member of several professional organizations, including the American College of Nurse Practitioners, Sigma Theta Tau, the International Honor Society of Nursing, and Psi Chi National Honor Society. Ashley is also grounded and rooted in her faith and family. And in her free time, she enjoys traveling and exploring new destinations. So let's welcome back Dr. Ashley Rowan, and let's talk a little further on what we touched on last episode. So last episode, we talked about depression. This time, Dr. Ashley deals also with internal medicine. So we want to kind of bridge the gap between depression and internal medicine, as this season we've been talking about health and how it correlates and the things we need to do, things we need to look at. So let's jump into our conversation of how depression actually affects our internal systems and how that relates to your expertise in that area.
So, oftentimes depression depression and anxiety manifest in physiological symptoms. Most times it becomes you're fatigued. All of a sudden your energy level, you just feel drained. You have to, you can barely stay awake during the day. You're just kind of slumped over. You used to be able to up and spry. You could walk, you could run, you could do all these different things physically. Now all of a sudden you just feel drained and fatigued and tapped out. Also, you're going to have trouble sleeping. Either you become, so lethargic that you're sleeping all the time, or, you're so worried or, that you're not sleeping at all. Most times when that happens, it affects your, the way you eat. So now you're eating more. So most times, either you're eating too much or not eating enough. And most of the times when you're emotionally eating, you're not eating, good things. You're snacking. It's the ice cream, the cakes, cookies, the chips. It's the sodas. Yep. That's what we do because it makes us feel good. It releases those endorphins. There is a science to why we emotionally eat. Because it actually releases a chemical called dopamine, and dopamine is that happy neurotransmitter. It's the neurotransmitter, like, I'm eating because I'm happy. I'm eating because I'm sad. Because it makes you feel good. It's like the comfort food. Joy say, hey, go get your favorite ice cream. You eat the half gallon.
Well, I don't
you
eat a
know,
half
so
gallon, but she sure gonna eat a whole pint. Let me tell you,
right. And then,
Haagen-Dazs preferred.
yes, well, at least Haagen Dazs is a good brand of ice cream. So if
Actually,
you're going to eat ice cream,
Suffocating
it's
is better,
healthy.
but I digress.
Yeah, yeah, yeah. I mean, Haagen Dazs, if you're going to eat it, that's probably the better of all the
But
other
you
ones.
won't find it in the health food store. You can go in the health food store and find Talente though.
Right, right, right. Yeah. I mean, well, the calories in it is terrible, but the ingredients is good. And so then we find, when we do become, depressed or anxious, it affects us physically. So now, our energy levels down, we're eating poorly, we have headaches, we have diarrhea or we have constipation. It even changes our menstrual cycles. We begin to have either early bleeding, late bleeding, all of those things, migraine headaches, stomach cramping, irritable bowel syndrome, all of those physiological symptoms that are now linked to, your mental health or lack thereof. So, I think, a lot of times when those symptoms happen, we got to make sure first we look back and say, hey, are these things related to changes in our world? So what happened? What has changed? Often when patients come in and they're coming saying, oh, I have diarrhea or I have this and that. We always go back and say, well, is there anything emotionally connected to this? Oh, I've gained an excessive amount of weight or I've lost an excessive amount of weight, because some people when they're going through emotionally, they don't eat. A couple of days can go by and they may have had maybe one or two meals, or their appetite is just not there. So weight can go either way. Obviously we're concerned both ways. Are we more concerned when it comes to weight loss? We're concerned about malnutrition, loss of bone, bone structure, fat structure, those things. When we get to the overweight or obesity area, obviously the more weight we carry, unfortunately, it triggers more health issues. So definitely, our mental health is a direct correlation with our physical health both ways. Because if we're depressed or we're anxious, we do have those physiological symptoms, but then we also don't take care of ourselves. So depression leads to us not taking care of ourselves. We don't go to the doctor, we don't eat well, we don't sleep well, we're not hydrating, we're not exercising, we're not doing those things. So we don't even have the energy, to even, engage in those things. Oftentimes as women, you know what? We've taken care of everybody. How many of us have taken family members to the doctors? Whether it's our children, our parents, our grandparents, we even take the dog,
Yeah,
to the doctor, and we don't go to the doctor.
because
We'll take
everyone else is a priority.
everybody, and that's one thing that we have to really learn to adjust. Is that it's a place of selfishness. We're taught, don't be selfish, put everybody before you. But in the real world, it's that you have to be okay. You have to be mentally, emotionally, spiritually okay, physically okay. And then you can take care of others. When you're on a plane, I love to use this example. We're in a plane. What do they tell you? If the plane's going down, they tell you, you put your oxygen mask on first,
Right.
and then you help someone else. And that's the best example. Take care of yourself. As unfortunately, when women are not heard in medicine, you can read all over social media. TikTok now is a big thing where people are trying to advocate more for women and advocate for ourselves, because you go into the doctor's office and you say, hey, I found a lump in my breast, or hey, I'm having some abnormal bleeding. And most times, depending on your age, depending on your weight, yes, weight, ladies, when you go into the doctor's office and you're obese, you're overweight, obese, morbidly obese, the first thing, everything is contributed to what? Your weight. Please don't take your weight as the answer. Okay, well, if I go home and lose weight, now my blood pressure's gonna be better, now my period's gonna get better, now the lump's gonna go away, now the headache's gonna go away, because if all I have to do is lose weight. There are that is a contributing factor, but most times there is some underlying disorder or illness that may be there that doctors are contributing to your weight. So if you go home and do this, come back 6 months, come back, and there are some things you can't come back in 6 months because it could kill you. Most common illnesses in women are, hypertension, also known as high blood pressure, high cholesterol, diabetes, thyroid disorders, strokes, osteoporosis. Ladies, please get your bone scans. Please go to your GYNs. Breast cancer, especially, is disproportionate among minorities, especially African Americans, are being late, diagnosed late. Please get your mammograms if you have family history, first degree. So that's mom or grandparent. You need to get mammograms early, starting as early as 35. Your pap smears and all those things annually. Fibroids, is another thing.
Yeah.
Making sure that we, get our appointments, and don't just take hysterectomy, ladies. That they're offering. Hey, yep, can't do anything else. Hysterectomy. There's so many other, treatment that is available. Hysterectomy obviously should be your last resort. Second opinions, please get second, maybe even third opinions when doctors are offering, especially in severe cases, of different diagnoses, and treatment options. Unfortunately, as women, we are not treated equally as men, especially if you're a minority. Have you experienced any of this stuff, going to the doctor at all?
Yeah, so like
Okay.
that's my question. So when we go to these doctors, because I've fired a few doctors in the last year or two,
Mm-hmm.
for not hearing me. If I'm telling, I'm no better expert on this body than me. You can't tell me more about me than me.
Correct.
And like, what can we do outside of firing these doctors and looking for a different provider when what you're telling them is not being heard or not being understood or being dismissed? Because I've found that a lot, especially here. I've been dismissed more than I've ever been dismissed in my life. And it's
In your
like, okay,
geographical location, like where you live now,
I'm
or,
in Georgia,
okay.
in the central Georgia area, um, specifically Macon.
Mm-hmm.
I now travel over an hour away to go to my doctor's. I will go to Emory, or any. I will go all the way to Atlanta to go to a doctor because
Wow.
they hear me and they take what I'm saying seriously. Now, what I feel, it may not be an emergency type situation that will lead to that type of diagnosis, but take what I'm saying seriously, because if it's a concern to me, it should be a concern to you as a practitioner. And I'm finding that that's not the case in a lot of instances, especially since the pandemic happened, because now everybody just wants to run up insurance bills. I literally this week had my colonoscopy. I went in because it was my 50-year-old screening. When you hit 50, you get to have all these
Mm-hmm.
daggone screenings. I put in for the appointment in May. I literally tell you, 3 days prior to my appointment, I had rectal bleeding. And I'm like, what is going on here? So at first I thought it was my menstrual cycle
Mm-hmm.
because it was close, but it's like, no, that's not just here. It bled for 3 days,
Mm-hmm.
like only when having a bowel movement.
Mm-hmm.
So it wasn't a continuous. But so I go in the office for my appointment that I made in May, and I tell them, they give you the paperwork, right? Do you have this? Are you experiencing this in the past or currently? I fill all of it out. I go through the appointment. I tell her, this is what I just recently started experiencing over the last couple of days. I haven't seen it in 2 days. Okay, great. I go to check out to make the appointment for the colonoscopy.
Mm-hmm.
Now all of a sudden, this is a diagnostic appointment and I got to pay. Why do I have to pay? This is a screening. You were going in there anyway. Why
Mm-hmm.
do I have to pay? Oh, because you said on this paper, and she was being nasty. You said on this paper such and such and such and such. So I have to come to the doctor and lie now? When
Oh.
the paper clearly says, are you or have you experienced?
Mm-hmm.
This appointment was made in May. I just so happened
To
3 days
have that issue.
prior to this appointment to have this come up. Well, needless to say, I went ahead and I paid it
Mm-hmm.
because they were saying, oh, I hadn't met my deductible. Well,
Mm-hmm.
okay, so now I'm paying you, I done met my deductible. The next day I get a call from the endoscopy center. Oh, you haven't met your deductible. We need this amount more. That's what they told me yesterday.
Oh boy.
So now at this point, we like $500 in.
From something that was going to be originally covered because it was a screening
Right.
process. Yeah.
So needless
Unfortunately,
to
that's
say, I
a
told the doctor. So
good.
he intends to write it up as a screening because it luckily there was nothing majorly wrong. It was
Mm-hmm.
just a tear
Mm-hmm.
or a brief moment or a cut, for lack of a better way to give you a more those listening a better context of it. Um so it was nothing that needed extensive work or like it. I'm fine. I don't have to go back for 10 years, thank God. But how can we advocate for ourselves given these
Well, the biggest thing is
shenanigans?
educating yourself. And if you, I think everybody in their family or friend group at least, has a nurse or a nurse practitioner or someone, or even just simply going online and finding out, you know, screenings times. A lot of times, doctors are, listen, I'm the first one to say we practice medicine. I say that all the time because we do that. Medicine, half of it is what you learn, the other half is having a heart. You can't expect for these people who you see to have a heart. You would think they would have a heart, but they don't. And so, knowing when to get screenings yourself. So knowing family history. I always say, listen, before you mom, you know, we don't know when any of us are going to go, but I always say, listen, talk to mom, talk to grandma, talk to auntie, talk to them, find out what was in their family, who had what, so that you have a detailed list of family history, because that's the first step, right? Is to know what your family history is so that you know what you're more predisposed to. Then it's like going online. You can go into CDC. The CDC, has all the, proper appropriate protocols for screenings. Womenhealth.org, have appropriate screenings, based on family history. So obviously, if someone first degree, grandmama or sibling or whatever has breast cancer, cervical cancer, uterine cancer, any of those things, your screening time is 5 years prior. Same thing with colon cancer. They started screening at 50. You can start doing Cologuard at 45. And so even if your doctor doesn't offer these things, it is very important. And now there's no excuse at this point unless you have illiteracy issues, and then still you can still get some assistance there with going online, knowing your rights. Again, now we have this ZocDoc and all these other different Yelps and all these other even your insurance companies. Google the doctors that you're going to see. Look at their reviews. That we look at reviews when we're going to hotels. We look at reviews when we're going to on vacation and resorts. So look at their reviews. People are pretty candid, whether they about good experiences or bad experiences. Going in with an open mind, going in with a notebook, or your phone with
Right.
questions. Prepare your questions before you get there, because oftentimes when you get there, you're like, you're already on edge, and whatever. Get your questions, medications, anything that's being prescribed to you. Ask, why is it being prescribed? What are the risks? What are the benefits? I don't know how long your doctor normally spends. We get 15 minutes. So we're insurance pays us for 15-minute visits. You can't, there's no way you're going to go through all that in 15 minutes, right? So it's never happening. So it's oftentimes you got to send, what is it, text messages and all these things through a portal communication and all of these things. But make them sit there. Don't let them leave. Don't leave with questions unanswered, because oftentimes you get home and you're like, or you're nervous. Another thing is calling advocacy. There's patient advocates. Now, depending on their mood, they may be decent, they may not be. But let the doctor know if you're displeased with them. Listen, I'm going to talk to your office manager. I'm going to talk to the patient advocate if you're in the hospital. You can even contact the insurance companies. They will withhold payments if you're
Yeah, I did that.
if you're dissatisfied. These are
I
your
came home and
rights.
made that call.
Good. I bet you he'll learn because when you get hit enough in the pocketbook, you won't, you'll think twice about doing that. But definitely, as a lot of things that, obviously with menopause and thing, bodies changing, hormones, can also lead to anxiety and depression. So, you may feel depressed, or you may feel anxious. And if it comes out of nowhere, like all of a sudden it's like a sudden thing, like suddenly, you have no reason, like you're like, life is fine, nothing's bothering me, and all of a sudden you're anxious, or all of a sudden you're depressed, or all of a sudden you can't sleep. Those are warning signs. So please don't chuck it off as, oh, it's okay. Definitely go make sure you get your annual lab work. Make sure you understand your lab work.
Yeah, that's
If
important.
if you don't understand, call your doctor. And if the doctor's unavailable, nurses are able to, go over them with you. Please don't shrug off your screenings. Denise just told us she's getting her colonoscopy, your mammograms, all those things. Do not shrug those things off. Preventative measures are better than curative.
Yeah, on all fronts.
Yep, on all
Mental
fronts.
and physical.
we prevent those things. We want to, and I think that's the biggest thing, is making sure we bring awareness and sharing your stories. If she didn't share this story, somebody else might have experienced this and wouldn't know what to do, or would have been scared. Many people have like, oh, they see something, and the first thing they, there's blood, is cancer, or whatever have you, and so that could have deterred her from wanting to go get screened down, right? So, saying that this stuff does happen, because everything that's, that may be abnormal, maybe nothing serious, or if it is something serious, it can be caught early on. And then, the survival rates or the curative rates are much higher at that point.
Absolutely. Yeah. So a quote literally just came to my mind. An ounce of prevention is worth a pound of cure. It's
Nice.
very important to be preventative on any front. And I think what happens is we just automatically panic. Like, cause I
Mm-hmm.
could have panicked in that moment, and I'll be honest and say I did.
Mm-hmm.
But what I did do, the first thing I did was I went to WebMed MD. Okay, let me see what this could indicate.
Mm-hmm.
And it and I'll say this: when you look up anything on Grandpa Google, um, be sure you're going to a reputable site,
Absolutely.
because otherwise you can get all kinds of information that's not always true or accurate. So I
Correct.
made sure I went to somewhere that was reputable, or like she said, CDC, or there's another one, NIH. I can't think of
Mm-hmm.
the what the NIH means, but NIH website. Go to a reputable website so you can see, okay, well, here's the possibilities, right? So when I looked it up, it was fissures, which was, the little tear, the little cut, hemorrhoids, and then the indicator of colon cancer itself, right? So there's possibilities, so you can see, okay, this may not be as major as
Right.
my panic is initially telling me that it is. It could be just something minor, like it was with me. It was just a fissure, something that healed over a couple of days, and I'm good. So take your panic, but use the panic. Don't allow the panic to stifle or, prevent you from moving forward. I think that's where we get caught up. So can let's just dabble in different areas. So let's talk about the area of menopause, because your girl around premenopausal age. I
Oh
can't wait for it
goodness.
because I'm sick of my menstrual cycle. I can't talk. I can't talk about nobody else. I'm over it. Like,
Yeah. I'm getting there myself. Now I'm not too far away. But obviously our menstrual period definitely contributes to a lot of hormonal changes. One of the things we want to make sure we stay on top of is early symptoms. So, and being precautious. So most people are like, okay, I'm hitting that 45 range or 50 range or 55. Typically, premenopause can start as early as 35. People can menstruate as late as into their early 60s. So
Rebuke
please
that
don't
devil in Jesus' name.
listen. It's bad, but it's there. Making sure that we finding out, when did mom start her cycle? When did she go through menopause? Because most times we tend to go in the same pattern as our mom or grandparent or sibling or aunt.
My
So
kids though.
hmm
Ain't even my case. I started before all of them. I started at 9 years old.
before your mom age.
My cycle started at 9, and by 51 they were done.
Hmm. That's about a good span. So that's about 40 years. So that's
40 years.
about the span. Typically menstruation is about 40 to 45 years, typically. And then diet plays a very big role in how our bodies and our hormones and all of those things, as far as like fibroids and different abnormal bleeding and all of those things. The average cycle should be about 4 days. There are people who are 2 or 3 days. There are people who are 7 to 10 days. Typically the longer cycles are due to sometimes poor diet, hormonal changes, weight, underweight, overweight, a lot of dairy products. There's research. So, everybody has like, oh, I'm not going to be vegan. I'm going to be vegan. I'm not going to eat dairy. I don't really get too much into it because everything is preference. Everything is in moderation. There's different studies. To be frank with you, you can probably find a study to support any theory or hypothesis.
Right.
But for me, as it relates to diet, I always limit your dairies if you can, limit your sugars if you can, limit your simple, your simple carb, like your chips, things that aren't going to really give you good energy, or your weight gaining things. Try to keep your cholesterol down. People are refute vitamins. I'm a real big person on vitamins. Women, vitamin D, your calcium. We don't get it. Vitamin D causes so many health issues and the lack thereof. So make sure that your primary care is drawing your vitamin D levels, your vitamin B12 levels, your folate levels. Be like, oh, there's vitamins, but these vitamins are structural vitamins that are needed to make your regulatory system work, especially with menopause. There's a lot of mood swings. So if you find yourself the hot flashes, the sweating at night, the irritability, all those things are contribute. If you find yourself starting, to spot in between cycles, could be an indication there's something wrong as far as like an illness, or it could be that you're starting menopause. Menopause isn't technically, you're not in menopause until you have not had a cycle for 12 consecutive months. So people are like, hey, I've had a cycle for 6 months, and then it shows up, they think something's wrong. It's not abnormal. So you have to go without a cycle for 12 months. Oh, and pregnancy
Yeah.
really big in that 45 to 50-year-old range, because we think, hey, the shop is closed. If you cannot be menstruating and still get pregnant, because your body's hitting the cycle. You don't know what's going on internally. So, you haven't had a cycle 3-4 months. You're like, hey, I'm in the clear. And then boom, you start ovulating, boom, now you're going to be 50 years old, becoming a parent. So, or parent again, or whatever have you. Some may be happy, some may not be.
I wouldn't be.
Me either, trust me. So, make
My
sure we're
pubes are tied.
practicing. I'll be in there like, Lord forgive me. But make sure we're practicing, unless you're married or in a committed relationship or whatever have you, please make sure we're practicing safe sex. And that's very important. You get to a certain age, you're like, oh, I ain't thinking about, you're not thinking about it, but STI rates are up in the above 40 range, including the HIV. There's gonorrhea that they have discovered that is that is antibiotic resistant. There's some other STIs that are going around too. They're also antibiotic resistant, that is mimicking like pelvic inflammatory disorder. So please, please, please be careful. when it relates to that, and as we get to menopause, we talk about vaginal dryness. Not a conversation people want to have, but it's a real situation. So please be careful with what you're using. You get, if you watch TikTok, like, oh, get coconut oil, which is terrible.
And cause you a yeast infection.
Right. So you're like, it's coconut oil because it's natural, but no oily products, should be applied.
Water-based lubricants.
Correct. All your water-based. And if you can, really try to get more of your organic lubricants that do not have, like the silicones and all those other preservatives. And you want to be careful of those things. They can also cause damage, to the vaginal area.
Just to go back, the NIH website I was talking about is National Institutes of Health. It's nih.gov. So utilize that as a reputable resource. Just by way of what you said about the gonorrhea thing, I got all kinds of horror stories. I went to the gynecologist. Nurse practitioner comes in. I was just there a couple of days prior because I have fibroids, which I just found out the size of my fibroids is like the size of a 12-week-old fetus. So I need to figure out what to do with that. But anyway, she's reading my chart and she asked me, are you pregnant? I said, no. I mean, you would have to have sex or even have a partner for that, right? I'm saying it in a joking manner, but I'm being true. And then she just heifer turns around and asks me, did I have gonorrhea? If it wasn't for going to jail,
she did.
I could have. Oh Lord.
That's interesting. So you told her you weren't
the old
Tanisha
would have slapped the crap out of her. Because for
you told her you weren't sexually active, but she still said
right.
Okay.
And you're looking at my chart. So you can see, and I had just had a PEP. So you can see nothing was on there. Everything is clear. But you're going to ask me if I had gonorrhea? There's no signs. There's nothing.
Wow.
Well, I fired them too, right?
Wow. I mean, I don't even know what would trigger that type of.
I don't know. I don't know. And I didn't take it nicely at all.
Mm-hmm.
Because at that point, I felt like you were stereotyping me. Because I'm Black?
Yep.
What does that mean? Clearly, I come here often. Because you can see in my chart, I don't miss an appointment.
Wow.
And I had been there the week prior. Certainly, when you went in and swabbed around, you'd have found something.
If something was there, it would have been showing up right then.
Right. So, as our final topic, let's hit on, I know we've talked about menopause because, we're closer to those ages, but for those listeners who are not in that stage or, may listen to it, who are in the stage of having children or wanting to have children, let's hit on the depression for them, postpartum depression, or just the changes bodily and mentally that they may experience in the pregnancy ages. I don't want to leave anybody out.
Yeah, one thing, as women, the fertility thing is a very big topic. Whether, especially with infertility, those who may be struggling with, trying to conceive, or those who may have multiple children. There's depression and there's stigmas and there's all kinds of things surrounding that, both physically and mentally. Especially when you get to a certain age, if you start hitting 30 and you don't have children yet, everybody starts asking, when are you having children? Not realizing that you may or may not want children, or you may be struggling to have children. And so we really have to be sensitive, when about those conversations, because we don't know people's journeys. And we don't know what people are struggling to do, and we don't even know if they even want children. I think, unfortunately, as women, it's like it's a given. You're a woman, you have children. Even if you don't want children, if you don't want children, then it's a stigma connected to that. If you want to be a career woman, now all of a sudden you don't want to have children, now it's a stigma. So really being careful what we say, and how we address people in that regard. There's pregnancy. Most times we're talking about postpartum depression. You'll hear a lot about that.
Right.
And that's basically the depression that comes after you have a child. But then they very rarely talk about depression prior to, depression while trying to conceive, or depression while pregnant. Most women do experience some depression during pregnancy, especially body changes. You go through the swelling, you go through the cravings, you go through not being able to fit your clothes, you go through the crying, all these different emotions. And because of the hormonal changes, then you feel like you might not be as connected as you once were pre-pregnancy, to your partner. You may not be as sexually driven as you were during pregnancy. So a lot of times women struggle with that. They feel like they have to push themselves in that area. Most times conversation. I think most of it is communication, communicating with one another, especially in relationships. Of how you're feeling, what you're feeling, during that time. If you're struggling with depression, whether it's pre-pregnancy, pregnancy, or postpartum, the biggest thing is seeking help. It's voicing that something's going on. Ask for help. We feel mom guilt, after we have children. We don't want anybody taking care of them. We don't want help. We want to do everything ourselves. We want to be like super mom. If we drop them off somewhere, we feel like life is over. You need the balance. It's very important to have that balance, in that. And if you're struggling with infertility or fertility issues, making sure that you get their proper exams, making a decision that if you want to have children, obviously now with technology, you can have children at, as late as you want, with the proper finances. Of course, these things are expensive.
Right.
But you can. And I think, not putting timelines, I love that, Tanisha brought up, just getting rid of timelines, because everybody isn't ready for children at certain ages. So, making sure
No, I
that you're
wasn't ready.
ready. No, I mean, listen, making sure that you're ready, and when you have things in your own, in your court, when the ball is in your court, so to speak, when it comes to that. And getting second and third opinions, staying up on your exams, diet, exercising, healthy weights, is very, very important during, childbearing ages. It also helps with menstruation and those things, birth control. When you get on certain birth controls, please talk to your providers. Let them know what your thought process is. Listen, I don't want to have children, or yes, I want to have children. I'm going to have children in this stage, because all of these hormones that you may need, because you're not ready at this point, they need to put you on an appropriate birth control, so that when you're ready to have children, it's easy. The transition is easy. So please make sure that you educate yourself on those things. Don't just be like, okay, yeah, I'll take it, walk out, and don't know what you're taking. So read up on it, read your packages. Now that we're in the age of social media and things like that, people talk about it all the time. You can read horror stories or great stories or whatever about different medications as it relates to this thing. So definitely educate yourself in that area.
All right. Thank you, thank you, thank you for this conversation. I really enjoyed having you for the
You're
last two
welcome.
episodes.
Thank you for
Um
having me.
Appreciate it. I will drop all of her social information in the comments, so you can follow her. She's in the Pennsylvania area. Reach out to her if you're in that area. And just have a conversation, letting her know what you're interested in finding out about her. Tell us what you have going on. And we'll go ahead and wrap up. Any
Thank
final
you.
thoughts, any final tips, and what you have going on?
Nope, just educate yourself. Be encouraged. Be aware. And always know that you're not in this alone. I think when COVID came around, the biggest slogan was like, we're in this together. And the truth is, we are in this together. You're not dealing with anything that no one else has not, or maybe coming out of or going into. So please, share your experiences, share your testimonies, share your fears, share your hopes, and do it with a mindset that you're doing it to help someone else. Let's kill that stigma of not being able to trust people and not being able to share your testimony or your experiences, because you never know what you may say can save someone else's life.
Absolutely. Thanks, Dr. Ashley. This has been
Thank
another
you.
episode of Broken Graciously, where we challenge the culture of brokenness by exchanging beauty for ashes holistically with candid conversations, transparency, and practical tips. See you next time on episode number 4.
Bye.
Thank you for tuning in to the Broken Graciously podcast. Stay tuned for weekly episodes. Follow me on IG at Tanisha B. Lester and the number 1. Don't forget to like, subscribe, and comment. Blessings.